Hi, thanks for joining us today for our Cara's Facebook Live. I'm Leah Bohr, I'm the Director of Training here at Cara. This is Joe Zucco, he's from NovaCare Rehabilitation in the West Loop, and he's here to help us today talk about foam rolling, the techniques, the whys, the ins and outs. So, Joe, can you help us understand the benefits of foam rolling and why it's going to help our bodies?
So I like to call this the poor man's massage. It's a really good way, it's a very cost-effective way to massage some of those sore areas in different parts of the body, but for runners it's really effective for all the different leg muscles that are constantly used with mile after mile of training. Most important thing, if we talk about the science of it, is that lactic acid buildup that occurs from training that causes us to feel soreness and pain will typically be helped and flushed out of the tissue when we use a foam roller on a regular basis especially.
Good. And so why this instead of stretching or on top of stretching? You know, we've been stretching for years and now the talk and the rage is all about the foam rolling. So should we replace stretching with foam rolling, and why are they different for our bodies?
So stretching is still important. It's not that it's useless. There are different forms of stretching, static stretching, dynamic stretching that are important to do.
Yeah.
But we also have the foam roller as a way to help, again, flush fluid through the muscle tissue, not only the lactic acid, but blood, those kinds of elements that will affect the system and reduce the soreness in the tissue. And with stretching, we just get this elongation of the tissue. So it's different in that sense. It's going to provide a different sort of relief of some of the symptoms from running.
Yeah. And it's a great thing to do while watching TV and spending a little bit of time. People, I think, people are reluctant to do things like this, but usually they can make or break maybe a really good training season or cycle.
Exactly, and as you get deeper into the season and you're experiencing more soreness, a few more aches and pains, and the muscles are getting a little beat up, this is going to be really important to do it regularly, especially deeper into the training season.
And preventative as well as the treatment, right? We want to do these things before we start to feel aches and pains, so that as we get deeper into the training season.
Yes, start now.
Start now. Don't wait. Never should wait. All right, so let's go through some of these techniques.
Okay, let's start with the muscles in the back of the leg. We'll start up high on the hamstring muscles.
Okay.
So I'll just have you sit on top of it here. And if we talk about where the hamstring muscles are located, back of the thigh, right? And they run from the sit bone at the top, or excuse me, at the bottom of our pelvis, down past the back of the knee. And there's a group of muscles that constitute the hamstring. So we want to either rotate the foot in to isolate more of the inner hamstring muscle that runs down the inside and the back of the thigh, as well as turning the foot out to roll over the lateral hamstring that comes down the back and the outside of the thigh.
Now, should people roll the entire length of the muscle?
You do. You don't want to go necessarily from the bone to the back of the knee, but you want to go through most of that tissue, most of the way in each direction. Because you might find that there are certain areas that are more sore and sensitive, and you may need to spend a little more time on those areas that are more sore.
Right. And the hamstring's a big muscle. So we're going to talk a little bit about using a ball of some sort, and this is a good muscle to possibly do that.
Yeah, if you feel like the foam roller is just a little too broad, it doesn't isolate and kind of zone in on those really sore spots, you can take a ball. You can take a tennis ball or a lacrosse ball.
Okay.
Or a larger ball. There are some gyms that make really large softball size balls that are really effective to use for that as well.
Cool.
Moving down to the calf muscles. Right?
My favorite.
So the same kind of concept in terms of muscle tissue being two parts, inside and outside. So again, we want to encourage Leah here, if we're talking about specifically her left leg, if we have her turn her toes in, and then we want to roll most of the way up to the knee and about 2/3 of the way down to the ankle. There's no need to go into that lower third, that's where your Achilles tendon is. No need to roll on a tendon.
Should we be going faster versus slower? Is the speed better?
Yeah, so some people like to go really fast, and they're usually trying to avoid pain.
Okay.
So I would suggest definitely trying to slow down.
Okay.
If you
Embrace
can tolerate
the pain.
it.
Embrace the pain.
Yeah. If you can tolerate it, if it's to a point where you can bear it.
And so you can have both legs on your foam roller like this, kind of spreading out your body weight to each calf. Or if you want to be a little bit tougher on yourself and your muscle, you can put the weight on one leg.
Yeah, with the calf muscle. Now this will be a little strenuous on the arms after a while, so just take the breaks as you need. But putting the other leg on top of it will definitely create greater pressure and a deeper release of the tissue.
How long should they be foam rolling? Not maybe in general, but just maybe on each muscle group. How long should they be doing it?
You want to spend at least a minute anywhere from 1 to 2 minutes. At least 1 minute on each zone that we're talking about. So a minute on the calf, on each leg, a minute on the hamstring, on each leg,
Okay.
etc. We're going to go over a few others here in just a moment.
Okay.
So why don't we move on to the IT band?
Okay.
The IT band is this long fibrous tissue. It's not a muscle, but it's a really important tissue to foam roll because it's involved a lot in some of the knee pain that a lot of runners experience. So this tissue, I want to show you just real quick on Leah's top side here. You don't want to roll over the bony areas on the side of the hip and pelvis. So stay just below the bony areas if you feel on the side of your thigh there. And you can go all the way from just below that bone to the side of the knee joint.
Yeah.
You want to make sure you cover that entire ground. Okay, that's really, really important. And a good little supplement to this is if you do find one particular sore spot, hold that and take your knee and slightly bend it from a fully straightened position.
Ooh, yeah,
and
I
just
feel
go
that.
from slightly flexed to fully straight. No need to bend too far.
Okay.
That's a way that you can actually create a little bit of movement of the IT band underneath the pressure point as you're holding that.
Kind of like the active release.
That's what we call an active release technique, yes.
Good.
And you can do that really with any muscle, any area that you
Oh yeah,
foam
I feel
roll.
that. So if I'm doing this and it hurts, is that okay?
It really depends on the person.
Okay.
It's typically, yes, it will typically be uncomfortable to some degree. It varies from person to person how intense it feels. Again, to your tolerance. If you feel like you can handle a little bit of intense pain for maybe 20 to 30 seconds
Yep.
and see how you feel afterwards, oftentimes you feel better immediately after.
Yep. And the more you do it, the more often you're gonna be
Yeah, you'll develop a little bit of
tolerance.
You'll desensitize to
Yeah.
it. Yeah, you'll build some tolerance to it, so it won't be quite as bad as you do it more and more throughout the season.
And should people be doing this before they run or after they run?
Good question. Usually we want to do it at least afterwards because the research shows that it's best when done post-exercise
Okay.
to actually reduce some of the soreness in the muscle and the tissues. However, if I have a unique case of someone who's maybe dealing with some knee pain, IT band syndrome, I will probably encourage them to use the roller for a minute or two before they run, and then again, of course, afterwards on the IT band and the various muscles.
Okay. All right. What's next after the IT band?
So let's go to the quads. Let's have you lay face down. Quad muscles are on the front of your thigh. Again, they run from the front of your pelvis down to your kneecap. And it's a very broad muscle. It has 4 components, hence the name quad. So you want to try to isolate each component a little bit more by, again, rotating the leg a little in or out. So with Leah here, if I have her bend her right knee, we can rotate the foot in to isolate the inner aspect of her right quadriceps. Good, and you would want to make sure you come up nice and high on the roller.
Okay.
So make sure you go close to the hip, especially if you turn more to your right, Leah, and get more on the outside of the quad, on the lateral part of the quad. That's very close to the IT band.
Yeah.
Typically, that's one of the more sensitive areas of the quadriceps.
Yeah.
So make sure you're rolling through the entire length of the muscle, which again comes up close to the hip, down to just above the knee.
Yes, when we went to a NovaCare foam rolling clinic, they told us that a lot of people always roll their IT band and they'll roll their quad, but they forget about this diagonal muscle right here on the diagonal,
Very important
the outer
also.
quad.
They're almost one and the same. As
Yeah.
therapists, when we're treating iliotibial band syndrome or knee pain from the IT band, we're almost always going to be also treating this lateral quad muscle and doing some forms of release on it as well.
Okay.
Let's move on to the adductor muscles, the inside of the thigh. So they run from your groin area of your pelvis all the way down close to the inside of the knee, but not quite that far. So you would want to have the hip flexed to about 90 degrees and the leg out to the side. All right? Excellent. And then you roll. You want to bring that roller most of the way down the thigh and most of the way up deep to the groin area.
I would think this is one a lot of people miss.
This is very often neglected.
Yeah, and nothing that people want to do at the gym usually.
Yes, it's quite a show, but
Yeah.
it's very, very important to do because you'll be surprised how often this actually is tender and sore.
Yeah.
All right, and then why don't we finish with the last little group of muscles on your shin. So let's put the roller.
Also probably neglected and much is very important, your shin. Your shin muscles.
Yeah, so we hear the term shin splints all the
Yeah.
time, and there's a few different things that cause shin splints, but If the muscles are sore from maybe doing some training uphill on an incline or such, that will engage those muscles more. Sometimes foot function makes these muscles work a little bit more. So they can very often be kind of sore and tender. I mean, you don't really actually realize it until you feel and put a little pressure on the muscle.
Yeah.
So with this one, you want to make sure when you're rolling on that shin area that you have your toes turned in just a little bit, because you want to exaggerate the pressure to the outside on the front of your shin. All right, because that's where that muscle tissue is. If your toe is pointed straight down, you're going to roll over the tibial crest, which is just bony tissue.
Yeah, I can feel that.
Now, anybody have any questions? You can always shoot us a message.
We do have a question. Lisa wants to know, should we only foam roll areas that are tight, or should we be doing a full body routine?
That's a good question. What I would suggest is definitely roll the areas that are tight without question, but I would periodically try foam rolling the other muscles, because you might be surprised and find that a few areas are more sore and tender than you realize, even though they may not be sore or aching to your that you notice throughout the day or with your running. So give the other muscles a shot periodically at least.
That's a good question. The other thing we learned at the foam rolling clinic, I don't know if any of you guys went to those, but posture is really important when you're running, and staying tall, keeping your shoulders back and open. So when we sit at our desk all day, we're often like this, and we're forming ourselves to not have good posture. And to loosen that up, we did the laying on your back on the long foam roller. So if you have a foam roller that's long like this, the technique, and maybe you want to go through this, but we just did a section where we laid on our back on the length of the foam roller, and then basically just laid there. You just kind of like feel your shoulders spread out.
Yeah, you can let your chest kind of open up and relax. You can bring your hands out to the side, what we call a snow angel position. And you can actually bring your arms up and down a little bit, or you can just relax and stretch.
Yeah.
This is a good way to kind of counteract some of those postural things that we deal with sitting at the desk all day.
Yeah, so we're obviously going to be focusing on our legs throughout foam rolling, but it's important to remember that your stance and your posture while running is going to help you in your form and staying healthy.
So one thing about foam rollers in general, we're just using a flat, high-density foam roller here. This is pretty solid, but think about this. If it's a softer or lower density foam, it's not going to feel, you're not going to have as much counter pressure, so it's not going to feel as intense. If you have something that's hard and plastic, it's going to feel a lot more intense, more pressure with that. There are also a lot of foam rollers out there that have grooves and ridges in them, and the idea of those is just to create more of a pressure point, so that it increases the intensity of that stimulation to the tissue as the foam roller.
Are there times that we shouldn't foam roll?
Yeah, that's a good question. You definitely don't want to foam roll over an area that you see swelling. That would be something, if it's swollen, you need to have a professional look at that. Either see one of the therapists at NovaCare with an injury screen, or contact a doctor for that. You want to be careful. Sometimes foam rolling can cause bruising.
Yeah.
So that's sort of on a case-by-case basis. If it's an acute bruise that just happened, you want to stay off that. Use common sense. If it's something that's been there for a little while and it's starting to go away, if you can handle the pressure and you don't feel like it's too sensitive, you can roll over a bruise in that case.
Okay, great. Do we have another question?
Yes, one of our audience members wants to know, where can you actually get a foam roller?
You can get them just about anywhere these days. Most sporting goods stores carry them. A lot of gyms, physical therapy clinics carry them.
Amazon.
If you go on Amazon, you'll be bombarded with the amount of options you will have. So that's why I just wanted to talk about 2 minutes ago, the different types of foam rollers.
Yeah.
I would suggest, if you haven't done it before, if you haven't purchased one before, just start with a nice high-density styrofoam roller.
Good. Because you can look on there and be overwhelmed about spending $100 and something on a foam roller. Don't think that that's the only way to go.
Yeah.
Maybe start with something simpler.
Yeah, and there's no need to spend, honestly, $50 or more. You should be able to find good rollers for in the $30 sort of price range.
It doesn't need to light up, and the color doesn't matter. It's going to get the trick done, so it's something to think about.
You want to show the tennis ball?
Oh, yeah.
Just for 30 seconds here. if we take a lacrosse ball or a tennis ball, just to get a little more specifically into the gluteal muscles, a tennis ball is going to be just a little softer, a little more forgiving. If you like deeper pressure, find yourself a good lacrosse ball. And we're just going to have Leah situate the ball underneath. So these gluteal muscles, there's several of them. And essentially, just like we instructed you with the foam roller, you don't want to roll over the bony areas. But any of those muscles on the side of the hip or towards the back of the buttock area are fair game. You can roll, just kind of go slowly.
Yeah, it's kind of about experimenting, feeling where.
Yeah, there's so many muscles in there, and you could have several little muscle knots and trigger points in there. So move around a lot on it. But if you find one there, you can do one of two things. You can either sustain the pressure and hold it for 30 seconds or a minute, or you can just kind of slowly move back and forth across that muscle. Find which technique works best for you and just stick with it.
Yeah, that's a good one. That one's a painful one as well. So, all right. Well, Joe, thanks for coming out today.
Thanks
Good tips, and hopefully everybody got something out of this. And go out and get your foam roller starting now. Don't wait until the over halfway point of marathon training to get going. And we'll see you next week.
Thanks, guys.